All right, guys, thank you for joining today. Today we have a very special guest, Nathan Gartland, who's a resident right now in anesthesiology, went to the University of Buffalo for medical school. But the cool thing is he also did a pharmacy degree right before medical school. So we're going to be diving into his whole story, his motivation, and what led him to the path of anesthesiology today. So Nathan, why don't you introduce yourself?
Alrighty. Well, thank you so much for having me on the podcast today. Super excited to be here, and I think we have a lot to talk about.
Yeah, thank you for coming. So tell me a little bit about yourself. You started in farm. Why did you first pursue farm?
Yeah, that's a great question. So, I had originally I was the classic story. Basically, I was good at math and science, and so I wanted to pursue something that was healthcare related at that
Mhm.
time. And my parents had been working with basically a grocery store, and they kind of cross paths a little bit with the pharmacy department at times. And they mentioned to me like, "Hey, this is a super great track that you should pursue. It's only a 6-year program at the time, especially if you go directly through high school."
Uh-huh.
And so while I was kind of teasing out the different career options at the time, I thought about medicine, but I wasn't entirely sure about it yet. And I think there was a little bit of imposter syndrome in the sense that I didn't think I had the gusto to make it happen. So
Mhm.
I thought, why don't I take this pharmacy route
Yeah.
and explore it a little bit further, and then I could always change later on. So,
Mhm.
because getting into these 2+4 programs for pharmacy, it's much, much harder to do
Mhm.
so on the back end versus if you just go directly through high school. So
Gotcha.
that was
Okay.
kind of the foundation that led me to pharmacy in the first place. I didn't have like the classic story where like I worked in a pharmacy or I did a ton of like had a shadowing experience or exposure to it. I really just kind of jumped, both feet onto this because of a little bit of influence from my parents who had
Mhm.
mentioned that, it was a good career path.
Okay. So you kind of developed that interest from them. And then when you got into school, did you enjoy the process? What were your thoughts while you were going through it?
Yeah, absolutely. So I guess I should break it down. So the first 2 years of my program, the 2+4, like I had mentioned,
Uh-huh.
were an accelerated undergrad experience. And so
Gotcha.
this was like your 18 credits of biochem,
Sure.
biology, gen chem. So kind of the routine stuff that everyone takes.
Hmm.
Some programs will do this in like a 3+4. It just depends on how they kind of structure things.
Okay.
So definitely had a little bit of a higher course load. I think like the standard's like 15. So we just
Uh-huh.
had like one extra course, which wasn't too crazy or anything along those lines. And we
Okay.
ended up taking organic chemistry. And so I ended up actually fulfilling a lot of my prerequisites to get into medical school during that 2-year phase, which was pretty nice.
That's good.
I did miss physics too. So that was one thing that didn't get completed because it wasn't required. So of course I
Uh-huh.
didn't. And at the time I didn't know any better.
Okay.
And so we can get into that later. But
Yeah.
essentially, I had done those 2 years and I was pretty confident that I wanted to pursue pharmacy at that time. I really hadn't gotten my feet wet with anything related to the graduate program. I had only done like this undergrad aspect. And so I didn't think that it was time for me to jump ship because I wanted to make sure that I gave pharmacy a fair chance and
Hmm.
I actually pursued it. And so I thought to myself, well, I can always switch after the fact, but it was kind of a point of no return where the problem was that all the pharmacy credits that I would be taking were non-transferable after my third year and beyond. So third,
Wow.
fourth, fifth, because it's grad school, so they don't really
Yeah.
go anywhere else. So if I wanted to pursue a different degree, I would have had to start back from that second year. So kind of walking through it, I talked about those first 2 years and they were
Uh-huh.
they were pretty good, kind of routine like everyone else experiences when they're pre-med
Sure.
or
Sure.
pre-health or whatever.
Uh-huh.
But yeah, then I started the pharmacy curriculum and that was awesome. I really did
Really?
enjoy it a lot. Yeah,
Oh, wow.
it was great exposure to obviously the run it like the very nitty-gritty details that goes into the decision making of how drugs are made. So a simple way to kind of paraphrase what pharmacy school is like. Your first year is really just routine, basic like bio, chem, but just kind of more revamped and more fine-tuned for pharmaceutical preparation. So we're talking about APIs, excipients, like really nitty-gritty pharmaceutical things.
Wow.
Basically like drug design, if you will. There's a class called pharmacokinetics and
Mm.
pharmaceutics. And pharmaceutics is like the big weed out class pharmacy
Wow.
school.
Okay.
And that's all about, like I mentioned, the APIs and
Mm-hmm.
understanding how different drugs interact with each other, but not just the drug itself, but like the other components that make up the formulation of the pill itself. Like, for instance, you look at one pill and you think, oh, it's just this is, lisinopril, but it's actually 15 different, pharmaceutically tested products that
Really?
create the drug itself, like, and
Okay.
create the pill itself, I should say, not the drug. And so
Interesting.
that's kind of the first year. And then the second
Okay.
year is when you actually get clinical,
Uh-huh.
which is super, that was probably my most enjoyable year, I would say, partly because the third year of pharmacy school, I was like getting ready for medical school. So that was a little crazy. But second year is really clinical. You focus a lot more on like the disease states, which is super fulfilling.
Sure.
And then third year is where you kind of tie everything together and you do like advanced level topics. Like this is therapeutics of the critically ill. This is ICU level, like pharmacy care. Kind of prepping you more so for if you were to pursue a residency in pharmacy, that would be kind of the courses that would lead you down a certain pathway. And that's also opportunities for electives. And then your fourth and final year of pharmacy school is kind of like the clinicals or clerkships, as
Uh-huh.
you will. They call them API rotations. And so basically, it's just a year of rotating through different pharmacies, different, healthcare environments to kind of get the exposure that you need to make sure that you're a well-rounded pharmacist.
Gotcha, gotcha. So you completed all of pharma school and you seem to have enjoyed it, right? You were saying you enjoyed the process of learning.
Yeah,
Um, okay, yeah, yeah. So when you went out and you were finished with pharma school, did you like enjoy the process of working as a pharmacist as well? I'm just trying to get a little laydown of like what was a transition that started you on to I want to be a doctor instead.
yeah, exactly. And like I had mentioned initially, like I did have that inkling in the back of my mind where I did want to pursue medicine, but I
Uh-huh.
just wasn't super sure. Like I didn't
Sure.
want to basically throw out a really good opportunity, which was the
Yeah.
career of pharmacy,
Yeah.
to pursue something that I might not be able to obtain in the first place. And so, like I mentioned, that imposter syndrome was definitely
Mm.
a key role there. And why throw away something when you have it all good and all
Yeah.
set up? And my whole
Hmm.
career path was lined up in front of me, so I didn't want to ruffle any feathers.
Yeah.
But then I ended up going on a medical mission trip actually in my second year of pharmacy school. So this would be like my fourth year of college, if you will.
Yeah.
And so when I went on that medical mission trip, it was really eye-opening. I was serving as a role of a pharmacist essentially, but in a different environment. I got to work alongside a lot of other healthcare professionals and seeing like firsthand what medical students and doctors get to do.
Mm.
And that really opened my eyes to maybe I do really want to do this and explore it a little further. And I actually had a mentor, and I talk a lot about mentorship and that being super, super important to influencing where anyone goes in their
Yeah.
career. But I had a mentor who was a pharmacy student in the class above me who had just taken the MCAT and happened to go on this medical mission trip. And when she had done that, I, obviously picked her brain about it, and she said, "No, you need to take the MCAT. Like this is your calling. It's
Mm.
my calling too." And so having someone a step ahead of me, kind of directing me down this path that was very nuanced, very unbeaten path, I suppose, for the pharmacy profession. Not a lot of people go down this route. And so
Yeah.
that was kind of the initial, feature that drew me towards it. And then I started researching it some more, started doing some
Okay.
shadowing experiences. And that's when I knew for a fact, like, okay, I got to give this a shot. And I ended up so I sat down. I knew like the first step is obviously the MCAT. I don't want to
Mm.
jump off the pharmacy ship before I actually have an MCAT score and know what I'm doing.
Yeah.
So I took the MCAT the first time around,
Mhm.
and that was disastrous. Because here I am thinking, oh, I'm a pharmacy grad student right now. I'm doing so well in all my courses.
Uh-huh.
However, I did not prepare for the exam whatsoever, and it was a very humbling experience nonetheless. So I thought
Hmm.
I could just jump in there and figure it out, and it didn't work out, of course. So back to the drawing board. I took some time off. This is the start of my third year of pharmacy school, so AKA fifth year, if you will.
Sure, sure.
And it was in the spring that final third year of pharmacy school that I ended up sitting for the second MCAT,
Hmm.
and I did a lot better on that one. I
Okay.
kind of reoriented myself, refocused, and kind of adapted the resources that I had at my disposal. And so that led to a good MCAT score.
Hmm.
And at that point, I had the score. I had taken the prerequisites. The physics two was the only thing that I was missing. So I ended up taking that semester too while I was
Oh,
studying for the
wow.
MCAT.
Okay.
So I had 22 credits on the books that semester, plus studying
Wow.
for the MCAT, and then starting my app rotation. So that was probably the busiest like spring of my life, I would say,
Wow.
even busier than
Yeah.
residency.
Uh-huh.
And yeah, that's kind of spiraled into applying to medical school.
Gotcha. So you applied basically right after you finished your farm degree?
No, I applied during my farm degree.
Oh,
So
so you're in your fourth year, you started applying.
yeah, essentially that spring of my third year, I took the MCAT in May,
Yeah.
and then it rolls basically for same as med school. For pharmacy, you roll right into your rotation, so there's no like summers anymore. And
Hmm.
so I'd started my fourth year, quote unquote, and was applying to med school. So I had completed one like clerkship during pharmacy school before I hit submit on my application. So I was able to actually use that on my application, which was helpful to kind of demonstrate some real world professional experience. And
Oh,
so yeah,
wow.
I ended up applying to and getting into med school before I'd even graduated pharmacy school.
Wow. That's pretty crazy. So you did all your interviews. If you don't mind me asking, how many interviews did you get with the background that you had?
Oh yeah, you're testing my memory here. So I will I'll disclose my MCAT was a 510, so I didn't exactly blow anyone out of the water with that. So I think
Uh,
that was a limiting factor for me. But with regards to like my GPA, I had a pretty strong GPA. So my science GPA I think was 391.
okay. Okay.
And I had a ton of credits too to kind of beef it up because I
Mhm.
had so many extra years of schooling at that point in time. But yeah, schools. I think I had gotten into, I interviewed at seven programs, if my
So,
memory
okay.
serves me, maybe eight. I can't remember exactly,
Uh,
but half of them were osteopathic and the other half were MD programs.
okay.
And yeah, I ended up at University of Buffalo. And so I had gotten the letter to get into medical school before I'd even finished my rotations.
Wow.
And so that was super exciting
Yeah.
to kind of like stress, relax and enjoy the rest of my fourth year of pharmacy school. I still
Wow.
had boards though to take, so that was a whole nother thing.
How was so you took your boards for farm and then how was the transition from finishing farm school to like directly starting med school?
Yeah, I would definitely say it was a whirlwind. I think
Uh-huh.
I was most at peace after I'd gotten in. But as things kind of winded down for pharmacy school, I had to sit for my boards and in I guess not a little different than medical school where like you take them throughout your training. I basically this is where you take them right at the end and you have to kind of graduate before you can even sit for them.
Yeah.
So I would say before I had matriculated to medical school in August, I was studying like crazy. So I ended up taking my last pharmacy board on the first day of med school. I ended up missing actually the first day because I was in the
Wow.
exam. So yeah, it was I definitely think I was a little burnt out at that point. So my summer was not a very relaxing one. I had to take my law exam, so New York State law exam, New York State compounding exam, which they of course got rid of after the year I took it. And then the NAPLEX, which is the like the big
The big
generalized licensing exam.
wow.
But yeah.
So you studied all that to pass that. Then you did you have to like play catch up for med school, like learn how to study, or were you kind of already set with doing grad school already?
Yeah, I think that was one of the biggest perks of having the pharmacy experience was,
Uh-huh.
of course, like the knowledge was one aspect. I think I had a hyper focus and, that's good in some sense, but also bad in others, where I think I would get some pharmacy questions wrong because I would overthink them, or
Yeah.
I would say that's not the right, like all of these are wrong answers. These are all terrible options, but so I think I would overthink a lot of the little things, the nitty gritty stuff, because I would like look
Gotcha.
back at the textbook. But what really helped was the mindset shift of knowing how to handle the rigors of grad school.
Hmm.
And I think, obviously everyone who gets into medical school has the gusto to make it through.
Yeah.
They've demonstrated that much to obviously get in.
Hmm.
But I think having that, I guess that initial culture shock of drinking through the fire hose, like that analogy we had used in our podcast,
Hmm.
I was used to it. I was ready to go. And so day one of pharmacy or of medical school,
Yeah.
I already was studying, and
Wow.
I had friends who were playing frisbee out on in the
Uh,
park and hanging out, and I was already doing my 6, 7 hours a day. So I hit the ground running, which was nice.
mhm.
And when it came to that first test day, you probably have a similar experience where you saw classmates who were just befuddled by how much information they had to learn
Yeah.
within the
And
cramming method. Let's say does not
oh,
work.
no, 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 not at all. Did you feel burned out though, doing what you did? Because kind of had like 4 years of grad school, hit the ground running in med school right away. Did you feel like this is a lot of work on you, or where did you have the exact opposite mindset of, I'm gonna do this. I don't care what happens. I'm just gonna finish this.
Yeah, I think burnout is everyone's subject to burnout to some degree, and I don't think anyone's immune to it. Like there will be a point where you will hit that wall, and I
Mm.
think I definitely did. I would say more so towards the end of third year. And third
Oh,
year
okay.
it has the reputation of being like the hardest and busiest time, but that was definitely I think where I was like I'm so sick of playing this game. I've been doing this grad school stuff for so long. Like I'm so close to the finish line. So I think that was definitely a time where I was like I need to, get away, decompress, and not really focus so much on the school stuff. So obviously I would still do my clerkships, but I think I didn't take them as seriously, especially towards the end of things, because in the grand scheme of things, your application was kind of set at that point. You really have
Yeah.
to perform
Yeah.
on your sub-Is and your boards.
Hmm.
The rest of the stuff had really been finalized. So I think to anyone who's like listening in, who's struggling with burnout, like it's important to prioritize the things that are important to you in your life, whether that's family, friends, all that stuff.
Uh-huh.
And I think that taking a step away actually gives you the clarity and the freeing sense of mind where you can actually go back in now refocused and
Hmm.
are going to have much better results down the line.
Gotcha, gotcha. So when you were studying for the boards as well as you mentioned, was there any benefit you had from going through grad school already? Or kind of was it like, okay, I'm using the study techniques, but with totally new material besides the farm stuff?
Yeah, that's a really good question. I think, with the medical boards itself, like they do focus a lot more on like diagnostic approach. And so a lot of that information didn't really translate very well.
Uh,
Because the way I like to describe pharmacy school is here is the entire diagnosis with every problem listed out, and you don't have to think about it. And then
uh,
they ask you, what's the third line treatment that would be best for this patient in this scenario? And so that's something that obviously was like how I trained for things. So I would memorize tons and tons of information. And I think medical school, so like to kind of back up, pharmacy is more so like you're an encyclopedia. Like you turn to the pharmacist, you ask them, what's the vancotroph? Like what's the dosing for
yeah,
this? And
yeah.
like, can we use this drug in this rare setting? And they just rattle it off like that. And you're like,
Hmm.
how do they know that? How do they do that? Well,
Hmm.
they've read almost every textbook and memorized almost everything on that page. However, I think where it misses or falls short is that it doesn't give you as many critical thinking skills. Like I've mentioned, everything is presented to you. So
Hmm.
then you kind of extrapolate what's given to you and figure out the treatment. So that's
Gotcha.
what was different with medicine, where I think I had to do a lot more like critical thinking, and the MCAT obviously tests for those particular things. Not to say that pharmacists don't critically think, our clinical pharmacists do, obviously tons of that, but
Hmm.
that's just kind of a small example of it. And so with the management of boards, I think it helped me a little bit with like the familiarity with drugs and mechanisms and all that stuff. So anytime there's a mechanism question, I was super excited about it. But I wouldn't say it translated super well with giving me some massive competitive edge over my peers.
Gotcha.
And you have to think too, like there's other individuals, like, and there was an example that I talk about sometimes where in anatomy, like I would say, oh, I'm this pharmacist. I know everything about, these drugs. But then I get into the anatomy lab and I know nothing
Mm.
about the
Yeah.
human body. And I'm
Uh,
sitting next to someone who's a PT or someone who did like their PhD in anatomy. Of course,
yeah.
they're going to rock
Know
that. So
everything.
everyone has different strengths for
Exactly.
sure.
That's true. That's true. It's very true. So you got through med school, you pushed hard, and then fourth year, you decided for anesthesiology. Now I can make assumptions on why you chose that, but what was your reasoning on why you chose anesthesiology as your final career path?
Of course. Yeah, I think of it as like the perfect hybrid. So I had to think back, what was I missing with pharmacy? I love the drugs, I love the pharmacology component of it,
Yeah.
but what was missing? And I think a lot of that was that critical thinking and also hands-on component. And so
Mm.
I was looking for a career or subspecialty that had both of those things. And anesthesiology is like the first thing that comes to mind, where I think it's like the perfect hybrid where we deal with, a very narrow end subset of drugs, but obviously you have to know them in and out, which kind of fulfills that pharmacy component and like the volume of distribution of the drug and some of these like principles that, medical students probably like sends a chill down their spine. But like for me, like I love that stuff. And so that was very nice. But then also the missing component of being able to work with my hands and to do procedures and to have the opportunity to kind of, get in there and do like an intubation or do like a nerve block. Like that's something that's fascinated me. And so that's kind of the reason why I fell in
Mm.
love with anesthesia.
Gotcha, gotcha. Okay. Yeah, that was kind of my assumption too. I was like, anesthesiology is a perfect middle ground between physician, pharmacist, and everything. And one last thing I want to touch on before we get towards the end of this podcast. You have the Physician Pharmacist, this great website, this great page. You have your own podcast that I was on, which I had a great time being on. I just want you to give a brief introduction for those people who might be in a similar route to you, who might be in farm school, might be considering farm school, but they're like, wait, is medicine the right route, or should I do medical school after? Just a brief note on what you've done and what you do for the community.
Absolutely. Yeah, so I created the physician pharmacist out of basically expressing my pain points of applying to medical school.
Gotcha.
And I sat down after I had applied and I didn't have any traditional resources. Like
Mm.
I did everything through Reddit essentially. And so I compiled all of this information into one short document that was about 4 pages long
Sure.
that really just like, was kind of a cathartic piece where I was just typing out everything that had happened.
Uh-huh.
And then I sat on it for an entire year, didn't think
Oh,
of it,
wow.
never thought of it again until basically I was like, hey, didn't I have a document? Like, because someone had reached out to me and asked
Yeah.
about my journey and my path. And so I found that and I had gotten a lot of people who are kind of reaching out and they referred their friend to the next person and so on.
Hmm.
And so that kind of prompted me to extend the document. Why don't I write a much longer version of this that can be a resource for people
Yeah.
to help them down this pathway? And so that's when I created PharmD to MD, which
Mm.
was like the book that basically describes my journey.
Hmm.
And it's kind of a self-help guide where you can pick
Yeah.
up the book at any point in time and then figure out where to go and how to apply to medical school. And I think that was definitely like a lot of people really were receptive to that.
Hmm.
And so then, because I had gotten, so much, I guess, publicity from that regard, I then thought, well, I should probably digitize this then. And so I made the website, and then the next thing led to the next thing, and now I have a podcast,
Uh-huh.
and so it's really been an amazing experience. And I think the most fulfilling thing about all of it, though, has been when I get those text messages. And I had someone text me the other day, hey, I just got admitted to medical school. Like, thank you so much. You just changed my life. And that is like the best part about this entire process is knowing that like I'm able to reach people who are struggling to, who aren't happy with their profession or where they're going
Yeah.
in life. And so I think that's the best part about all of this. And those are the people I'm hoping to serve.
That's a wonderful purpose. And um, yeah, wow, great job, man. Helping people in those rough paths, getting into med school is no easy task at all. And if you're helping those people out, very much props to you. Thank you for that. And for anyone listening to this, please go check out the Physician Pharmacist YouTube channel and his website. He has plenty of content out there that's really helpful. I found it really helpful skimming through it myself the other day. But before we end, Nathan, we have a tradition on this podcast where the guest from the previous episode asks a question for the current guest. And then I'll have you leave a question for the next guest upcoming. But the question for you that was left was, what is your ikigai? And exam meaning of ikigai is what is your purpose in life? What is the meaning of your life? If you have an answer for that.
Wow, that's a pretty deep question. Meaning of life. Wow.
Meaning of your life, yeah.
Meaning of my life. Well, I think, the first thing is obviously my commitment to my family, to my fiance,
Yeah.
and that is obviously, I need to be there for them and their, times of need, and like this whole residency process and all this stuff is ups and downs too. So like they've been there for me, and so I think that's probably the most important thing is like being there for my loved ones. But the
Okay.
second obviously feature is being a good physician and
Mhm.
impacting all the people that I come across every single day in my clinical practice and changing and impacting their lives. I think those are the two most direct ways that I can like have a really fulfilling and I guess, great life that leaves an impact on people. And then the physician pharmacist is just a kind of a tertiary thing that, I connect with strangers on the internet who are, across the country and they're having a difficult time. And I think that's also something that gives me a lot of purpose. I don't know if it's like the pinnacle of my
Yeah.
existence, but it's definitely something that I do enjoy and it's a fun hobby.
Got it, got it. That's a very beautiful purpose. I mean, I think that's how we should be. Everyone aspiring to be physicians, that should be one of our forefront purposes. Do you have a question you want to leave for the next guest?
Sure. That was pretty deep. Let me think. How about what is the best book that you've read
Hmm.
in the last month or
Oh,
year? However
oh,
many books you can read.
okay, okay. That's a good question. I always feel like if someone can answer that question, which I feel like some people might not be able to nowadays, but people who do answer that question gives a like insight into their personality, like what type of things are they interested in. It's a good question. I'll be sure to ask that.
Wonderful.
Well, Nathan, thank you for coming today. It's an honor to have you. It was an honor to be on your podcast. And I wish you the best and keep continuing this journey of anesthesiology and helping other people on their medical journey as well.
Well, thank you so much for having me. It's been a pleasure.
Thank you.